What are the causes for ankle pain? So normally causes of ankle pain can be categorized into two categories. First is because of trauma or any injury, and second is because of non-traumatic reasons. So traumatic reasons include injury to ligaments, muscles, capsule, bones, fracture, or there is a condition known as osteochondritis dissecans, in which a part of the cartilage becomes loose and it can become painful. So if there is any obvious fracture in the ankle, or there is any ligament injury or tendon injury, then depending on the kind of injury and the extent of injury, you may be required to immobilize your ankle, or it might require a surgery also. Non-traumatic reasons for ankle pain includes capsular impingement. Capsule is normally a sheet-like covering between the bones, which can get impinged between the ankle bones and cause pain. Secondly, it can be because of repeated strains to the tendons or the muscles around the joint. Thirdly, it can be because of primary osteoarthritis of the ankle, or it can also occur in conditions where systemic involvement is there, like in gout, which causes hyperuric acid syndrome in the body, and that crystals deposit in the ankle and can cause pain. Similarly, conditions like rheumatoid arthritis can also cause ankle pain. Also, any infection of the ankle joint can also lead to pain, or any avascular necrosis or reduced blood supply around the ankle joint can also lead to bony architecture deterioration, and that can lead to pain or arthritis in the joint. So normally these are the reasons for ankle pain. Now if you are suffering for ankle pain since long, your doctor will get your X-ray or MRI done to investigate the reason. But normally three factors predispose to ankle pain. First is obesity. Second is if you are an athlete and you are not doing proper warm-up. Or third, if there is repeated strain or injury because of any reason. So if you are suffering from ankle pain, get your MRI done, or see your doctor who will get your MRI done, and now depending on the problem, he might advise you the further course of action. The normal further course of action normally includes rest, ice fermentation or hot fermentation depending on the pathology. Next, he will give you pain medicines or anti-inflammatory medicines. Also, he will supplement you with medicines for faster healing of the tendon or the capsule if at all there is any injury. He might ask you to keep your leg elevated for some time and give you an ankle immobilizer for 3 to 6 weeks, or he might ask you to put a complete plaster also. Now all these things are supportive, but once the acute pain has been taken care, he might ask you to undergo physiotherapy and later on rehabilitation before you can get back to your sports activity or course. If the condition is severe, like there is a fracture or a frank tendon rupture or a ligament rupture, or there is osteochondritis dissecans, then you might require a surgery as well. So if you are suffering from ankle pain, don't worry, visit your doctor who will get your ankle joint investigated through X-ray or MRI, and whatever is the best treatment option for you, he will advise you. Thank you.